Alrighty. Good morning, my name is Gabriel Lopez. I'm the PA student. I'll be taking care of you today, if that's alright with you.
Yes, that's fine.
Okay, cool. Before we get started, can I go ahead and confirm your name and age?
Sarah, and I'm 35 years old.
Okay, well, good morning, Sarah. What brings you in today?
Well, I've just been having a lot of pain, in my abdomen that just kind of goes all the way to my back.
Okay, so, using one finger, can you kind of go ahead and show me more or less where you're feeling the pain?
Like up here.
Like up here?
Yeah.
Okay. And when did you first notice this?
It just came on suddenly after like eating a lot of food,
Okay.
like a big meal.
And can you tell me a little bit more about the pain in terms of like quality?
Yes, it's just really persistent. It's very sharp. It's kind of like stabbing pain that I'm
Okay.
getting, and it kind of like trails back to my back.
Okay, so, is there anything that makes it worse?
Well, I've yes. So eating like a greasy meal or anything like that. But I have noticed that like if I lean a little bit forward or kind of
You're
sit
bringing
up
these to
a
your
little bit,
chest.
right? Like it helps it feel a little better.
Okay, and have you tried taking anything for the pain?
I did. I took like some Tylenol and it did give me some relief, but like I still feel that stabbing pain.
Okay. And then, as far as, you know you had mentioned that it was after the meal, has it, been going on since then? Does it kind of come in waves, or has it been persistent?
No, it's been
Is it
persistent. Yes.
Okay, has it been kind of getting worse as time gone on?
Yes. Like it was just like I feel it.
Okay, and then do you notice any other symptoms?
I've been feeling nauseous, and I've also vomited like several times since I've had this pain.
Okay, and then, do you have a fever? Well, does it tell you there if you have like a fever or anything? I would know that.
Yes,
Yeah, you have a fever.
I've had fever, bloating.
And then it would tell me also, I wouldn't know this before going into it, does it have like heart rate, blood pressure, that type of stuff?
Yes, it does.
Can you tell me those?
Yes. HR
Heart rate.
is often elevated, reflecting the body's stress response to pain.
RR?
Okay.
Oh, it doesn't have numbers?
No. It's
Okay.
usually normal.
Then okay, so then fever is fine. Okay, so symptoms. Okay, so just to make sure that we're on the same page, yesterday you said that you were having, a nice meal, it was a bit of a greasy meal, and then after that you noticed that you started to get some pain up here, and you're calling it like a shooting pain or a stabbing pain that kind of goes in towards your back. On a scale of 1 to 10, what would you rate it at?
I rate it like an 8.
Like an 8, so it's been pretty bad, and it's once it started, it's kind of continued to get worse. You noticed that you also had some nausea, and you said that you vomited, correct?
Yes.
The vomit, did it have, was it a lot, was it a little?
It was like with bile, like stomach.
Okay, so it was,
kinda.
okay. And, ever since then, it's been kind of continuing to get worse, and you've been running a little bit of a fever. Is that correct?
Yes.
Okay, and so before we kind of move on, I'd like to know a little bit more about you. Do you have any sort of history of allergies?
No.
Okay, what about like to food or drugs, anything?
No.
Okay, have you been hospitalized recently?
No.
Any like lifelong illnesses that we should know about?
No.
Asthma, anything like that?
Mm-mm.
Okay, any surgeries?
No.
Have you been anywhere recently, like, that's out of the ordinary?
No.
Okay, and I know you said, you had taken some Advil or Tylenol and it kind of helped a little bit. Are you taking any other medications?
No.
What about like birth control?
No.
Okay, and as far as, these questions might be a little bit sensitive, but, it's in good confidence, you don't have to worry about us telling anything, everything's private. I do like to ask these questions to make sure that we kind of have a better understanding of what's going on. As far as like smoking, do you do any smoking?
No.
What about alcohol?
There is an occasion where I'll have a drink or two, and there are sometimes where I kind of binge drink a little bit, more so on the weekends.
Okay, and then you had said you binge drink a little bit on the weekends sometimes. How much alcohol would you say that you drink?
Like 5 to 6 drinks.
And how frequently are you having the 5 to 6 drinks?
Every other weekend.
Every other weekend? Okay. Okay, so I'm gonna go ahead and start to perform a physical exam, just so I can kind of get a better understanding of what's going on. First, I'm examining the patient, just kind of like looking at him. I wouldn't be saying this, I'm just saying this so that they know. And then, is there anything that it says there that I would notice, like maybe they're sweating, maybe they look sometimes it'll say like they appear in distress or anything like that. Or it is just kind of like normal.
Possible fever
Okay.
and
Tachycardia, so your heart rate's kind of up. Okay.
yes,
All right. So I'm gonna go ahead and
and possible signs of dehydration.
okay. Yeah, I'm gonna go ahead and take a look into your mouth real quick. So if you can please just kind of open wide.
And blue.
You say ah. Thank you. Okay, I'm gonna go ahead and have a listen to your lungs real quick. Whenever you feel me place the stethoscope on your back, I'd like you to go ahead and take a deep breath in and out through your mouth. Just like that, alright? Okay, next I'm gonna go ahead and recline you to a 30-degree angle so I can take a listen to your heart. Okay, hopefully, if you can go ahead and lay flat. Okay, so I'm inspecting the chest, any signs of heaves or thrills, anything like that. Look at the carotid. Now I'm gonna go ahead and take a listen. Okay. Alright, next I'm gonna go ahead and recline the bed all the way back. Okay, you can go all the way down. Alright, if you can go ahead and put your feet flat on the table for me. Thank you. And if you can put your hands at your sides. Alright, so first I'm expecting the abdomen. You said that there were signs of distension or what did you say it was?
Bloating.
Bloating. There you go, that's the word for it.
And
Couldn't-
dysentery.
yeah, it's the same. I couldn't think of the real word. Okay, so first I'm gonna go ahead and take a quick listen. Just try to relax. Okay, I'm gonna listen to some of the blood vessels in here too. Okay, I'm gonna go ahead and check some lymph nodes that are right where I just went ahead and took a listen. Alright, next I'm gonna do some tapping on your abdomen so I can kind of go ahead and take a listen to the sounds and then let me know if there's any tenderness or discomfort, alright? Next I'm gonna go ahead and apply a little bit of gentle pressure. Let me know if you feel any sort of pain or tenderness.
There.
Okay, yeah. Okay, I'm gonna go ahead and apply a little bit more pressure now. In the region right there.
Yeah.
Okay. Next I'm gonna go ahead and I'm gonna place my fingers and then when I release, let me know if you feel any sort of pain. All right. Any sort of pain or tenderness? Well, I guess you'll be able to find out there. Okay, no worries. It's fine. That's the rebound tenderness. It's okay. Okay. Next I'm gonna go ahead and try to take the feeling. Okay. Go ahead and breathe out. Okay. Now go ahead and take a deep breath in for me, please. Okay. And then if that causes pain, we'll say pause it and freeze over there. Okay, next I'm gonna go ahead and do the same thing over here.
Wait.
I'm just feeling for your spleen. Okay, you can go ahead and relax. Alright. Okay, you can go ahead and come on up. Okay. So it's based on your history, what you told me that yesterday you were having a headache. And then do you get the paper as well? Maybe the paper will help you out. Okay, so based on what you told me, that yesterday you were having a, large meal, and that all of a sudden you started to kind of develop this kind of upper abdominal pain right here in the middle. Oh, I'm sorry. Actually, can you go ahead and read the physical exam results for me?
Yes, tenderness and guarding in the upper abdomen upon palpitation, possible abdomen distension or bloating, and then possible signs of dehydration due to the vomiting, or electrolyte imbalance, possible fever and tachycardia. Yeah.
Okay, perfect. Yeah, so that goes right in line with what I'm thinking. So, based on what you told me and kind of some of the things that I'm finding, yesterday you had a big meal, and then afterwards you started to kind of have some pain. You had some nausea and vomiting, and you described the pain as like a shooting pain, like if it went through you straight to your back. And the fact that it's kind of been getting worse, and that you put it at, I think you said it was like an 8 out of 10.
Yes.
As well as some of the physical exam findings with the rebound, the guarding, and where the pain is located. It seems like you might have a case of what's called acute pancreatitis, as well as some of the history with the alcohol use. So what I'd like to go ahead and do, that's the first thing I'm thinking. I'm also thinking that maybe it's like gastritis or peptic ulcer. You didn't say anything about a positive Murphy sign, so I don't think it's acute cholecystitis, but it could be. So what I would like to go ahead and do, that was the purpose. So what I'd like to go ahead and do is we're gonna go ahead and order an abdominal CT. So you can go ahead and take a screenshot, basically of what's going on inside here, that area that you're having problems with, and then we can take a look to see, if there's any sort of inflammation in the area, if there's any sort of calcification with the pancreas, and depending upon the results, then we kind of have a better understanding of, how to approach from here. If it is what we're suspecting, the good news is that typically this is just supportive care. So we might actually admit you, but just to kind of give you IV fluids and to go ahead and rehydrate you, to monitor you, to make sure that doesn't progress worse. And if that's the case, you should be feeling better in, a couple of days, which is unfortunate. But on the bright side, if it is that, then we won't have to perform any surgery or anything like that. It would just be some stuff like antibiotics and things like that. But that remains to be seen. We'll go ahead and find out more once we kind of get the results of the test back. But that's kind of what we're thinking and leaning towards at the moment. Okay. So I always like to kind of go ahead and make sure I did a good job of explaining and that we're on the same page. So can you kind of try to tell me what the game plan is as far as what I've told you?
Then we're gonna go ahead and do a CT scan to see more or less like what's going on in there, and then we're going to evaluate that.
Yeah, basically. So we'll find out more once we get the results back, but it does seem like that's the kind of the way that it's leaning. So yeah, was I right? Was it acute pancreatitis?
It was pancreatitis, yeah.
It is pancreatitis?
Yeah, pancreatitis.
Yeah, the nice thing is that the CT will tell us more, like if it is or if it isn't. It could have also, you didn't have a positive Murphy sign, so I don't think it was acute cholecystitis. And then it could have been gastritis, and I could have made a mistake, and I probably should have gotten. But it seemed more like pancreatitis based off what you were telling me and stuff like that. Anyways,
Yes.
okay, awesome. All right, yes.